Hey, good morning, everybody. It is great to be with you. And today we are talking about an important issue that impacts Kansas City. I know there may be questions on other issues in Kansas City. I'll look forward to answering those at the end of our time talking about our fentanyl campaign. About 5 months ago, we announced our work toward launching a public education campaign about the dangers of fentanyl in partnership with Barclay, OKRP, to raise awareness about the risks associated with taking counterfeit drugs and preventing overdose deaths in Kansas City. I'm proud today to announce 2 milestones in our efforts to combat the fentanyl crisis. We are now nearing our campaign launch and asking Kansas Cityans to share stories about their loved ones who were taken too soon as a result of fentanyl poisonings and overdoses. The stories submitted will be shared in an innovative and compelling way to break through to our Kansas City youth, helping reach those who may be at risk of a similar fate and guide them toward a different path. The campaign, called Unfinished Legacies, leans into storytelling and technology to uplift these stories. As a reminder, overdose deaths in Kansas City continue to surpass record-breaking homicide deaths. In 2022, there was only 1 day in Kansas City without a suspected overdose in city emergency rooms. And between 2017 and 2021, Kansas City saw a nearly 1,000% increase in synthetic opioid deaths. I was personally shocked by this data, and I'm especially concerned about our young people who are falling victim to this epidemic each day. An overdose does not have to be the end of your loved one's stories. Though heart-wrenching, the stories I heard from families during our Fentanyl Summit I hosted in December show the immense resilience that surviving families continue to have during such devastating times. I have heard how desperately they want to prevent another young person from taking such dangerous and deadly risks, and one of those stories was Miss Juanita Coburn's son, who passed away in 2019 due to a fentanyl overdose. We'll hear from her shortly. As we address the fentanyl and opioid epidemic, those who are directly affected play an important role helping us fight to end it. Please share your stories and save a life. Starting this morning, you will be able to visit the campaign website, kcmo.gov/unfinishedlegacies. That's kcmo.gov/unfinishedlegacies to submit your loved one's stories. As we receive stories, we will share more updates and information for how Unfinished Legacies will be implemented and rolled out around our community. I'm also proud today to announce the appointees to our Overdose Review Board. After I heard about the incredibly dramatic numbers that we had in terms of fentanyl deaths and overdoses in our city, City Council acted, we all acted to make sure that we were doing more to follow up like an epidemiological approach in terms of how we address where some of our issues are coming from and how we can prevent. Our Overdose Review Board is made up of industry experts and Kansas Cityans directly impacted by the fentanyl overdose epidemic. The board will meet regularly to review overdose data and provide real-time recommendations to the city to combat the fentanyl epidemic. Our appointees are the following. Our chair is Dr. Alex Francisco, the Kansas City Health Department's Chief Science Officer. Dr. Douglas Burgess, a psychiatry specialist at University Health, Behavioral Health Recovery Health Services. Gregory Parr, a certified peer specialist and executive director of the Neighbor to Neighbor program. Trey Conklin, trial team leader for the General Crimes Unit at the Jackson County Prosecutor's Office. Dr. Uttam Garg, director of clinical chemistry, toxicology, and biochemical genetic laboratories at Children's Mercy. Emily Haig, the CEO and president of First Call. Shannon Roberts, the Senior Program Manager for UMKC's Collaborative to Advance Health Services, and Dr. Lindsay Haldeman, Jackson County's Chief Medical Examiner. Major James Buck, finally, the Special Investigations Division of the Kansas City Police Department. The Health Department continues to work to investigate overdoses to find out where laced narcotics began and ensure it does not expand. We know accurate and efficient reporting in fatal and non-fatal overdoses will help with prevention. Dr. Marvia Jones, our health director, will talk more about that in a moment. I'm hopeful that with efforts to improve overdose reporting, launching an innovative campaign that helps share this information, and collaboration between stakeholders on the Overdose Review Board, we will be able to overcome the opioid crisis. I encourage all of you who have been touched to share your stories, all of you who have been impacted, to be honest, forthcoming, and sharing, if not with law enforcement, then with anyone, to make sure that we can stop the spread of this epidemic And I thank all of you who will stand with us on the Overdose Review Board for working to address this incredible challenge. Coming up in the following order, we'll hear from Dr. Marvia Jones, our health director. I'll just introduce them now. Mariah Haberman, VP of Communications at Barclay. And finally, Juanita Coburn, who I mentioned before. Then I'll come back for questions at the end. Dr. Jones.
Thank you, Mayor Lucas, and good morning, everyone. My name is Marvia Jones. I'm the director for the Kansas City Health Department, as the mayor mentioned. I'm just going to reiterate that as a health department, it is in our best interest and for the interest of our residents that we continue to remain involved with working with partners to address the opioid epidemic in response to the rapid increases that we've seen. This is not a normal or expected trajectory of our data, and that's why we want to take particular interest in it. At the Fentanyl Summit that the mayor referenced, we learned a couple key takeaways. One was that there needs to be a balance in the messaging. It needs to balance prevention, destigmatization for those families who've been affected, as well as the balance of offering treatment and care. So we realized from that summit that we needed to figure out the right balance for that. It couldn't be too heavy-handed on one of those topics or another. We also realized that there are many agencies that are already working in this space and that we would benefit from a more collaborative approach. Thus, the Overdose Fatality or Non-Fatal Review Board will also assist in bringing that coordination to bear. The Overdose Review Board is an important tool in our efforts to address the fentanyl crisis, bringing together stakeholders from the enforcement, treatment, healthcare, research, and prevention sectors, working collaboratively to both share information, share learning, as well as share resources will go a long way to helping us address this epidemic.
Hi, everyone. I'm Mariah Haberman, VP Communications Director at Barclay OKRP, a creative idea company based right here in Kansas City. Teaming up with the city of Kansas City to launch this campaign, Unfinished Legacies, our aim is clear: to save the lives of our kids and young adults. Fentanyl's deadly grip often hides within what feels like familiarity, where trusting friends as sources for drugs can lead to tragedy. It's called Unfinished Legacies because these victims aren't defined by their fentanyl-related overdose. Fentanyl doesn't have to be the end of their story. We want to honor their personal stories and experiences with the hope of preventing a similar tragedy from happening to someone else. This is undoubtedly one of the most important campaigns we've ever had the privilege of working on. By sharing local stories of those affected by the fentanyl crisis, we hope all of us will better understand the seriousness of the issue, be inspired to take action, and ultimately save lives. Thank you very much.
Hello, how's everyone doing today? Thank you for having me. My name is Juanita Coburn, and my son was taken from his family from fentanyl. I wrote a little bit. I know they said I have 2 or 3 minutes, so if Mayor comes with a red cape taking me off like James Brown back in the day, I'll be okay. My son's name was Jordan Coburn. He was taken from his family from fentanyl. He was a loving son, father, grandson, brother, nephew. He was given a fake pill by his friends. I was told I have 2 to 3 minutes to speak, which I already said that, okay. But on March 19th, on March the 3rd of 2019, I received a call from his girlfriend. She told me my son was cold and not responding. His 3-year-old son, baby Jordan, found him on the kitchen floor and told his mom, who was 8 months pregnant with their second son, Ramonte. Hold on, y'all. Which was on, just give me a moment. The last time that I see my son alive was on March the 2nd. He told me what he was gonna name his son, which was Ramonte. He came to my house to tell me what they were gonna name him. After I got the call from his girlfriend, we rushed to Jordan's house, which we were met by the police and paramedics. He was covered with a white sheet, and they would not let me hold my son or, even see what was going on with him. I still have that sheet that they had on him. We then went to the police station, stayed there for hours. At that point, I assumed it was natural causes. I then had to prepare to lay my son to rest. At the funeral home, my family was very supportive. As a family, we had to view the body, so I invited his friends to kind of soften the blow before the wait and the funeral and the services, not knowing they were the cause. So my family gets through the funeral and all. Then on April the 18th, 2019, his second son was born, Ramonte. I was in the room when he was born, and I was the first one to hold him. It was a much-needed celebration that was bittersweet because my son should have been there. As we were all adoring Ramonte, I get a call from Lee Summit Police Department Detective Tracy. He said the cause of my son's death was fentanyl. I had no clue what that was, so I looked it up. My son was not an addict. How could this happen? My grief then turned to anger. Long story short, one of his friends gave him a perk pill laced with fentanyl. Now, I know they didn't make the pill, but they never told me where they got it from. I grew up in an era not to take candy from strangers, yet on Halloween we would get to trick or treat. Never understood that concept, never asked my parents. Never asked you that. I grew up when a group of mothers against drunk drivers would get out in the community, go to grocery stores, churches, you know, all in the streets. They were mad as hell and they wanted justice and they wanted it. Not even during their grief because they did not know any parent to go, they didn't want any parent to go through it. Still to this day, going through it. Until our community gets mad as hell and puts faces behind these victims, nothing will change. I stand before you right now because I am mad as hell. And I want a change. Should no family have to go through what my family has went through? My son's death certificate says drug overdose. That's not true, it was murder. October 12, 2019, a Lee Summit man was charged with murder in the second degree after dealing drugs which killed a victim due to heroin and fentanyl by Jackson County prosecutor Gene Peters Baker. That was the first case in Lee Summit where the dealer actually was charged. My son lived in Lee Summit. Why are they not looking for where he got that pill from? The victim in Lee Summit was Caucasian female. My son was black male. I'll leave you with this. Every case should be treated the same, no matter what the race. Until we as a community scare these young kids and adults, there's not going to be a change. And we need to scare them like the Mothers Against Drunk Drivers did. At the beginning, I spoke of not taking candy from strangers. We need to add to that list, not to take a pill from a friend, because it could end your life. Thank you for having me. Forever Jordan 23, Devontae Coburn.
Any questions for any of you?
I'd be curious, Ms. Coburn, the idea of being able to tell stories about those loved ones that you've lost, why you think that would be helpful in what you're hoping would happen to convince people don't take that pill from a friend. And you stand by the mic.
Oh.
Like this website is doing, it's asking people to share their stories about their loved ones.
Yeah, and
Do you think that would be helpful?
I think it'll be very helpful. The first summit that the mayor hosted, that was my first time really speaking to the public of what happened to my son. I'm from Cleveland, Ohio. My family didn't even know. I told them natural causes because that's what I thought. So it's been a relief for me because now I'm speaking and I'm mad and I want to help other families. So it does help.
Other questions? All right, thank you so much. All right.
There is a challenge bigger in that they can mix this with so many other.
Yeah. Look, this is a substantial challenge. I think what Ms. Coburn mentioned at the end is the hardest part. You teach young people about not taking candy from strangers. You think about, and we think in many ways about the criminal justice system as people who are trying to directly harm someone else. And when you're looking at the transfer of pills that are laced among friends, when you're looking at sometimes loved ones, intimate partners, and others who are part of, frankly, what is this trafficking? It creates an incredible challenge for us. And the other thing, and the reason that we have the health department involved so intricately in this with the Kansas City Police Department, with the prosecutor's office, and with communicators and families, is because there's not one message that can work. We can't just say, we're going to put you all in jail or something like that. We can't just say that everybody's going to get counseling. It is something that impacts some people. Some are dealing with addiction. Some people frankly, run into an unfortunate and incredibly unlucky fatal incident. And so this is why we are trying to communicate as broadly as possible, and this is why we're bringing people together. You know, there are many things, we don't talk about it much, but there are many things that I learned from the COVID-19 era. One of which was how you do tracing, how you talk about things, how you can limit prevention, how you can try your best to keep people safe. It may not work with everyone, but certainly the more we were able to communicate, the more we were able to say, hey, share, make sure you're letting us know, where were you exposed? Save another life. Right? That's the sort of thing and the reason that we're working together on this today. Any other questions on this topic? All right, if not, I'll let you all depart and we'll talk a little bit about stadiums.
Thank you.
Thank you.
Take care.
Yeah, appreciate it.